Thanks so much for joining us for this panel on increasing accessibility in the disabled community. My name is Marian Jones. I'm the Bronx organizer at Transportation Alternatives. Advocates and community leaders have long known that cities' youngest, oldest, and most vulnerable street users are disproportionately affected by unfriendly design that leads to injuries and fatalities. In this session, we'll hear from advocates that inspired and demand change, which resulted in breaking through to City Hall and enacting change that leads to streets becoming more accessible. We're joined here by JohnRoss Rizzo of NYU Langone Health, Daniela Aragoni of AARP, and Susan Doha, the Executive Director of the Center for Independence of the Disabled. John, do you want to start?
Sure. Thank you so much. Greetings from NYU. Really happy to be here. Thank you so much for the introduction and the opportunity to speak to you all. And thanks to all my co-speakers for all the wonderful work they've done within this space. So J.R. Rizzo here from NYU Grossman School of Medicine and also the Tandon School of Engineering. So I just wanted to take a few minutes to talk a little bit about my background and some of the work we're doing here at NYU. So I am a physician by background. My specialty is physical medicine and rehabilitation, so disability medicine. I do hold an active medical license in PM&R, but I also trained as a scientist, having completed fellowships at the National Institutes of Health and then also at our Clinical and Translational Science Institute here at NYU. And then most importantly for this panel, I'm a consumer. So I'm legally blind presently. I've been legally blind for about 20 years. I was born with a retinal dystrophy called choroideremia. And so I've watched my peripheral field basically degenerate over the last 35 years or so. I have about 2 degrees of central vision, so enough to make me dangerous, as I say, in both good and sometimes bad ways. And I like to consider myself, I guess, most importantly, as a steward of New York City. I direct labs and an innovation division here at NYU School of Medicine that supports the creation and development of tools to improve access at greater scale. And we work on full spectrum tools from low tech, so things like mobile technology, to high tech, so things like advanced wearables and instrumented book bags with really cool stereoscopic camera systems that feature cutting edge approaches for all types of microservices. So to give you a sense of some of the things that we're working on, I just wanted to give you a flavor of the kind of 51 varieties of Ben & Jerry's ice cream. In terms of our microservices, I figured I'd talk about a few. We have some really cool new GPS solutions that we're working on for improved accessibility. One is what's called 3DMA GNSS, which you may have read in some articles or seen on some cool magazines. So this stands for 3D Mapping Aided Global Navigation Satellite Systems. And this is basically building geometry meets satellite visibility. So whereas in most cities, we suffer from the urban canyon, and we all know, and when we hail Ubers, it's very frustrating when our cars are jumping back and forth and we're trying to figure out where our car is when we hail some of those services. Rather than suffering from that urban canyon, we take advantage of it and we can figure out where the reflectance patterns of those satellite signals are by taking basically maps and understanding the surface topography of New York City and then figuring out those reflectance patterns, creating candidate locations, and then isolating where you are in the city with much better accuracy. We also do very unique things within camera-based technologies, something called vision place recognition. And this is really cool. We take basically cameras and phones, we acquire images, we reduce them to line drawings, and then we create these special mapping databases. And then we could take your same mobile technology, we take the camera feed from that phone, and then we match it for localization. So this leverages artificial intelligence and this really cool, unique detection capability that matches edges and environments with these mapping databases that we've created. And we can do much better than existing GPS in terms of localization. And what's nice about it is we can also pull orientation from it. So we can tell you actually where you're headed, which is very useful for people who are disabled, particularly those with visual disability. We do things within the adaptive video coding space. So a lot of people are talking about using machine vision to improve accessibility. But what's really interesting about that is as we were able to take higher resolution images, it's very computationally expensive to handle those images. So we have to come up with adaptive techniques to figure out how we do that, both spatially in terms of image resolution, also in terms of temporal, in terms of frame rate, and then lastly, in terms of what we call amplitude or quantization. And we're trying to figure out how to handle that adaptively through algorithms. We're creating fun things, or at least we consider them fun, in terms of network policies that optimize their connection opportunities. So for example, Link NYC and public Wi-Fi. So can we use satellite signal buttressed by public Wi-Fi? And then also have cloud computing capabilities, and how do we create Genie policies to figure out what do we take advantage of to maximize the time to process something required to improve accessibility, whether that's a high resolution image that we can then analyze with some neural net to say, here's an obstacle and you need to avoid that, or something else. This is really important in terms of maximizing safety. And then we're also working on how to improve the architecture of some of these neural nets to improve both the detection and recognition capabilities to make sure that we can really get those objects of interest to those who need it most. So improving things like commuting, et cetera. So I think in conclusion, I don't want to put you all to sleep. I just wanted to give you a quick sense of the types of work that we're doing. We advocate for strong solutions from low to high tech to disrupt inaccessible gaps in our current city footprint, really improving access for all. So hopefully that gives you a little bit of a sense of what we're working on, and I'm happy to take any questions on any of those topics. So I'll throw it back to my co-speakers. So thanks so much for your interest.
Thanks, John. Really appreciate that. Danielle.
Yeah, hi. Should I launch into the full presentation or just do quick intros?
A full presentation.
Fantastic. Well, again, thanks so much for having me. I apologize, I was a little late. I was on a call I couldn't get off of. I'm really happy to be here today. I'm going to go ahead and pull up some slides just to guide our conversation. And again, thanks to the rest of the panelists for joining this conversation today. Again, happy to be here. So I'm Daniela Rigoni. I'm with AARP, Director of Livable Communities for that organization. And I want to quickly sort of walk through a little bit about some of the ways in which we can support advocacy for increased accessibility for all people, really. So this is kind of our driving data point, if you will. We are rapidly aging as a country. That's no surprise to anyone. Everyone's aging individually, but as a country, we're actually reaching a point very soon in 2034 when we are comprised more as a country of people over 65 than we will be of people under 18. That's the first time that will have been the case in our country's history. And that really begs the question, are we ready as a nation, as communities, for that demographic future? Arguably, we're not. We're looking at the fact that in housing, we are ill-suited and not providing the kind of housing solutions that people require, either from an affordability standpoint or from a design standpoint. We know that there's a huge gap in the amount of housing that includes accessibility features. We're also just not designing the right size of housing, frankly. When you think about parks and public spaces, again, there's a mismatch. We're not designing places that bring older adults into them in ways that you would expect as their relative share of the population. And we know that parks are not designed equitably, they're not distributed equitably, and it has very real implications from an environmental, from a health standpoint for residents in that area, in those areas. Transportation is, of course, key now, and I'll get into that a little bit more here. And I know that's the heart and soul of transportation alternatives. We know that older adults outlive their abilities to drive by anywhere from 7 to 10 years. And in a day and age when transit funding is in crisis and when bike and ped fatalities are on the rise, it begs the question, are there viable alternatives for older adults when they can no longer drive? And frankly, all of these built environment features really roll up to and contribute to a sense of increased loneliness and isolation in older adults that has very real physical and mental health effects. So what are some of the sort of roadblocks to these age-friendly communities as we like to think of them? These are places that, when they're done well, they are serving the needs of people of all ages. So there are a number of roadblocks that we see from our vantage point. First of all, there's a lack of options for when people stop driving, and there's unequal access to quality transit, unequal access to safe bike and ped environments and other solutions. As I mentioned, we have a public transit system that's in crisis, and yet it is the lifeline for many older adults and people with disabilities. Overall, we see that bike and ped fatalities are increasing, and that older adults represent a disproportionate share of those in 35 states. And of course, as yet another layer to this, COVID introduced a whole nother set of barriers, frankly, to accessing transportation alternatives from the perspective of older adults. So what are some of the things that we can do about that? Well, there's quite a few, actually. I mean, I think we all would agree, and I know that a report came out earlier this week from about our infrastructure and how we're failing basically as a country in terms of providing adequate infrastructure. But there's a need to clearly invest in better and more infrastructure, which includes safer bike and ped resources, better public transit, better lighting, better signage, better road maintenance. We can work harder to ensure that existing infrastructure meets the needs of all, that schedules and destinations match the needs of those it's trying to serve, that payments and discounts are easy, particularly for older adults, and that crosswalk signal timing and crosswalks themselves are visible and clear and doing what they need to be doing. There's a role to educate older adults on using these options as well. I think it's tough to learn how to use public transit if you've never had to before, or perhaps it's been decades since an older adult's been on a bike, or maybe never had. But a little education goes a long way in terms of demonstrating how alternatives can in fact be very important and viable transportation solutions. And at the root of it all really is this desire, as you'll hear, from our perspective, to engage older adults in planning as well as implementation. So the way that we go about that is in a few different ways. I mean, certainly at our roots, what we are trying to do is support local leaders and communities to think differently about their housing, transportation, and public spaces to create places that work for people of all ages. We offer a framework for doing that, which I'll talk through quickly. Grants, which are open now, so if that piques your interest, there's money on the table to be had. We have a number of tools and resources for local leaders. And one thing I want to drive home here, assuming there are folks across the country who are dialing in, is that there are ARP state staff and volunteers in every state willing to partner with you. So quickly, our age-friendly network is that framework that I mentioned. It is a 5-year voluntary framework for jurisdictions and states to evaluate their communities from the perspective of housing, transportation, built environment, and more, to see how they're faring, how are they doing in ensuring that those work for older adults. And more importantly, it's a framework for action. It begins with listening. It begins with creating diverse coalitions. And I think everybody on this call understands that advocacy needs to be rooted in understanding the needs and building diverse coalitions. And the degree to which many of our age-friendly communities overlap with complementary programs, such as grants from CDC on active transportation, such as the Bicycle Friendly Communities Program and Dementia-Friendly Community Programs, other things like that. It's all a way of saying that there are these would-be partnerships on the table that can be had by exploring your needs through an age-friendly lens. So I certainly encourage you to use our map to find out if you reside in a community that is an age-friendly network member. As I mentioned, we run a grant program annually, and we're right in the middle of the open season for applications this year. Our Community Challenge grant program will award about $2 million this year in quick action grants that are meant to help communities make the case and demonstrate new techniques that can be leveraged for better accessibility, for better quality of life for people of all ages, all abilities. These grants typically are made in public space and transportation arenas, so very well suited to the discussion we're having today, and encourage you to think about applying. In the past, they've been used for things like crosswalks and bike racks, public art, ciclovia events, bicycle education, and much more. So that window is open now. It closes April 14th. More information can be had at arp.org/livable. And again, one of the, a couple of the ways that we talk about here, in terms of, we've seen grants in the past, I should say, that very clearly focus on how we can think differently about our existing infrastructure and make it more accessible. We've made a number of grant awards in the past that speak to how do we build an accessible seating into our public spaces? How do we expand our trails and paths to ensure that they work for people of all abilities? How do we build in signage that works better for people with memory issues or dementia, and so that they too can enjoy our public spaces? So a lot of really good creativity and innovation has come forward through that challenge grant program, and we encourage you to apply this year too. A couple other tools I want people to be aware of, our wonderful Livability Index, which lets you understand and evaluate or ascertain in your community how well you're doing from a livability standpoint. Every community is listed there, and it gives you kind of a starting point for action. We also invite you to check out our livable interactive map, which lets you identify past community challenge grants, as well as age-friendly network members in your state, in your region. And then I think the most important takeaway here might be, in addition to the grant dollars, our newsletter, which is comes out just about every Wednesday. It is focused on practitioners, local leaders and practitioners, reaches about 110,000 people now every week, and really encourage you to sign up for this free newsletter that's full of resources, ideas, and announcements. Another of the resources that I hope many of you are already aware of are our free publications. I think perhaps we may be best known for our walk audit, which is a frequently cited tool used by bike and ped advocates to get community members out evaluating their neighborhood. So that's just one of the many tools that we offer. We encourage you to explore all of these, and particularly recommend to you, the fact that we have walk audit worksheets available in English and Spanish. We have a pop-up placemaking guide that we released about a little over a year ago that includes recipes for how to do these temporary demonstrations and much, much more. So please do take a look at those. And again, we'll make those available for free in print or download. I wanted to quickly touch on a few different examples of how our work is happening in communities as a way of kind of painting a picture for what that advocating for increased accessibility might look like. So in Tucson, Arizona, for example, they're a member of our age-friendly network. That work, that 5-year voluntary program that they're going through now, focuses at their request, at their desire, focuses on expanding transportation alternatives, specifically around complete streets, ped and bike safety, and overall kind of enhancements to make sidewalk and transit more useful for people with differences in how they get around. And there are a number of different programs that they've brought in to help them accelerate work in that arena, one of which was bringing in service year volunteers to help them get open streets activities, to get Ciclavia events up and running, even despite COVID in this last year. Miami-Dade County is another jurisdiction I think that is very, it paints a picture of how other communities can follow suit. So they've been a member of our network for a few years now, as well as several jurisdictions within that county. Again, their plan focuses very intensively, very purposefully on transportation, how to make pedestrian safety, how to improve pedestrian safety, how to improve walkability, how to provide better driver education for older adults and promote public transit use. One of the things that they identified was that older adults have a difficult time taking buses because of the heat, because of lack of places to sit, lack of shade coverings, in addition to sort of those barriers that might exist in terms of familiarity. So one of the resources that they tapped into was our Community Challenge Grant Program. They were able to construct these, what they call age-friendly benches at transit stops in the county last year, a couple of years ago. And finally, Columbus, Ohio is another one of our age-friendly network members. Columbus has done a whole bunch of work in this arena, but specifically in transportation, they've really, I think, done some fantastic work to put in place new neighborhood transportation circulator buses, to complete a safe routes to age in place study with the state DOT. And one of the programs I think is so interesting is this partnership program between Villages, which is a private member-based service delivery mechanism, if you will, that helps people age in place. They've paired those villages with Lyft so that when villages are unable to provide volunteer driver offerings, the members of those villages can tap into Lyft, and those Lyft drivers have already been trained on how to better help and support older adults or people with disabilities. So those are just a few of the examples. Lots more information on our website, and happy to take questions and engage in conversation at the end as well.
That was great. Thanks, Danielle. Susan, do you want to go? You're on mute still.
That won't work at all, will it? I'm Susan Dua, Executive Director of Center for Independence of the Disabled in New York, Sydney. And I want to thank Transportation Alternatives and also thank my colleagues who've gone before me and made intriguing statements about opportunities for new technology and opportunities for voluntary action to bring about a more livable landscape and transportation sphere. I want to offer you a perspective from the disability community that has benefited from more than 40 years of advocacy on transportation and the streetscape for people with disabilities, aiming to remove barriers to full and equal access for people with disabilities. I am going to begin by telling you that anyone can acquire a disability. People acquire disabilities as a result of birth, disease, workplace hazard. If they're like me, they have a traffic collision. I was hit by a taxi and I now have a traumatic brain injury. Sometimes people acquire disabilities simply by the process of aging. People have difficulty seeing, difficulty hearing, difficulty picking up their feet, moving their legs, fatigue while standing or walking, lack of balance, all of those things. Disability prevalence rates differ in different communities, and so I'm glad that Danielle brought up inequities. Disability prevalence rates are much higher among people who are Black and people who are gay, lesbian, or bisexual, according to the existing literature. People with disabilities are far more likely to be living deep in poverty on a long-term basis. In New York City, the rate of people living below 100% of the federal poverty level is 36%. That's very, very, very much higher than for people with no disability. And approximately 58% of people with disabilities are living below 200% of the federal poverty level. So as we look at solutions, we need to be looking at very low income people who may not have access to all of the technological solutions that we may think would be appropriate for them at this juncture. I want to mention as well that our disabilities may be visible or not visible. People with disabilities are often thought of also as people who are needing assistance, when in reality, we're very much capable of contributing to creating a more livable community for all. We are neither pitiable in this nor heroic. We just want to be part of an open community that includes all of us. People with disabilities should be able to participate fully in all that life has to offer, rather than being segregated or excluded. Disability civil rights laws have long reinforced the right to equal access and place an affirmative obligation on public accommodations to remove barriers to access for people with disabilities. We have long been involved in removing barriers as an agency. We have worked on all kinds of issues in the community, and very much particularly on open spaces and on transportation systems. And this is because inaccessible transportation systems and inability to use public thoroughfares is a key barrier to education, to employment, to healthcare, to social integration. And it results in gross disparities between people with and without disabilities in all of these areas, and gross inequities for people with disabilities. Campaigns to create accessible transportation that we're involved with usually begin by community surveys. We begin by documenting the barriers that people are experiencing and reporting to us, something like what Danielle was talking about. And we do training for people with disabilities to go out and examine the streetscape, examine the sidewalks, examine how livable, in Danielle's terms, our community is. We then involve people who are affected, and we invite them to talk about how they're affected by these barriers. We organize testimony in order to bring these issues to the public, to policymakers, to reporters and the media. We are very interested also in pressing our point home. And so we're willing to organize demonstrations together with allies and attempt in working with public authorities to negotiate successful settlement solutions that can bring some of the problems we identify to resolution. However, sometimes it's been necessary to rely upon civil rights laws at the federal, state, and local level to press our point home when all efforts at public education, at negotiation, at creating better understanding have seemingly failed. We have achieved a great deal through this process that we've engineered over many years. And for example, the physical accessibility of buses is as a result of a campaign by the disability community that involved demonstrations and then ultimately litigation to bring about lifts on buses. We also advocated for marking of subway edges so that people who are blind would not fall off edges of the subway, as our staff were known to do on occasion and risk their lives as a consequence. We were successful in winning that, although that's still a work in progress. We did a campaign to make the taxi system more accessible and won an agreement that was to make 50% of the taxi system accessible for people who use wheelchairs by a date certain. Sadly, that agreement has not been fulfilled by the city. Our advocacy campaign has resulted in public-private partnerships to install subway elevators where building is being done. And we've supported those campaigns through the city planning process. We're interested now in changing zoning to permit more subway elevator building. The law says that every time a new staircase is built or a staircase is renovated or a major renovation is undertaken, federal law requires that an elevator be put in. And so we're looking forward to seeing more renovation on that score. While we appreciate the good intentions of the MTA, we attempted discussions with them which failed. And so we've been forced to go to court pursuant to New York City human rights law to bring about an agreement to achieve the full accessibility to the fullest extent feasible within the shortest time frame possible through litigation, or we hope negotiation and a settlement agreement. We also are negotiating for access to bus lanes for paratransit vehicles, taking a paratransit ride, which is supposed to be a substitute for subway accessibility, but is certainly not, is very slow. You can take a 4-hour bus ride to get 20 minutes from your house. And this causes people to miss their job interviews, to be late for work, to fail to attend community meetings, to be unable to attend gatherings of family and friends, and so on. So we're looking forward to seeing on-demand paratransit services and also faster paratransit services in addition to full subway accessibility. We're very interested in the streetscape and improvements we can bring about in terms of the streetscape. We did a study, a disability person-fueled study of every street corner in Manhattan. We fanned out all across the city after training with a tool that was created based on the Department of Justice guidelines about what curb cuts should look like at corners or at other junctures. And we found, of course, that most of the corners in the city are not legally compliant with federal law, and that many of them are in fact dangerous, and that's why people who use wheelchairs or canes often tip over into the street, into the path of traffic, because there is a deep hole at the end of the curb cut, or because the curb cut is so steep, we call it a suicide ramp. All of these issues need to be addressed, and that's why we went to court to see that they're addressed. We won an agreement that will bring about fully compliant curb cuts citywide by a date certain. Unfortunately, as a consequence of COVID-19, the Department of Transportation has invoked force majeure and is saying that they can't move forward with that agreement to make curb cuts accessible, sadly. So we'll see about that. We've been raising concerns for some time about city-owned vehicles being parked on sidewalks. If you go near any court building, if you go near any police station, any firehouse, you see that the sidewalks are blocked every day by vehicles on those sidewalks, making them impassable for people who use walkers, wheelchairs, or other devices, or have difficulty with balance. People are forced then to ride or to walk in the streets in competition with bikes and cars, which is, as we know, very dangerous, proven to be very dangerous. We've been supporting the installation of crossing lights that emit a sound to let people know when they can safely cross the street if they cannot see the light. We've been raising concerns about how pedestrians, how wheelchair users, how people who use canes or walkers, or are simply unsteady or have difficulty lifting their feet or moving quickly, can coexist with bikes and cars. We have supported making the streets narrower so that crossing time can be more meaningful for people as they attempt to cross the streets. We have concerns about new street designs because they reduce the predictability of crossing the street. If the bike lane isn't where you last found it, but is now on the other side of a lane of parked cars, and you have limited vision or you are blind, how do you know where you are relative to moving traffic and moving bikes? So we see more work to do in the future as we become more reliant on bicycles and other vehicles, as well as cars. We are very concerned about the issue of pedestrian and bike rider coexistence in our streetscape. People on my board of directors, people who work for me, people that we serve citywide, and last year we reached, through all of our programming, about 80,000 people in New York City. People contact us and tell us that they have been hit by a bike, having been hit by a car, which is, I'm sure, much worse. I understand nonetheless that being hit by a bike can destroy your chair, can knock you down, can break your hip, and can cause other problems, and that we need to find ways of peaceful coexistence together, because we do welcome the opportunity for bikes to be part of our environment. We do very much support the use of our streets, by the way, to spur the local economy. We very much want to see local small businesses survive COVID-19. We're very concerned about this because small business is often the engine of jobs for people with disabilities. And so we have been encouraged initially to see small businesses taking to sidewalks and streets to bring their business to pedestrians. And however, our support for this has been tempered since it became obvious that the expansions have not been made accessible for people with disabilities. Either there are no ramps into the business area, or there are no safe ramps. They're too steep, they're too short. They cause you to bump into chairs, or they are interfering with access to curb cuts. I've seen planters placed at the top of a curb ramp so that if you get to the top of that curb cut in your wheelchair or with your walker, you cannot turn safely because you're turning on your side. You're not turning on level ground. So these are a few of the issues that we would like to negotiate out. We're excited about more plazas, but we have questions about the placement of planters, tables, chairs, and other objects in the path of travel, and how that might affect people in both positive ways, because we like benches for people who have fatigue, And we like the opportunity to sit at tables outside with our friends. But we're also concerned that cluttering the path of travel can have very negative consequences and make public spaces very foreboding rather than very welcoming. We hope that all of these issues can be resolved, and we look forward to be part of the resolution. We hope to be involved in the planning stages, because we can tell you that retrofitting environments where decisions have been made without respect to people with disabilities or older people are very hard to retrofit. It's much easier to plan a universally accessible environment than it is to retrofit one that people are now dedicated to that is entirely exclusionary. So throughout our years of advocacy, we've had wonderful support from allies all across the community in helping us to bring about a more accessible, more transparent city. And we too hope to bring about a more bike-friendly city. We hope to bring about a more public place-friendly city. And we certainly hope that civil rights concerns will not be subordinated to other concerns as we go about doing this. So I'm very much looking forward to your questions and looking forward to having a much more inclusive transportation system and streetscape in our future. Thank you so much for listening. I hope to hear from you now.
Okay, great. Thanks so much, everyone. Really appreciate all of that really helpful information. So the first question I have is for everyone here on the panel. What's the top issue or biggest challenge for those with disabilities or with older adults that advocates and elected officials aren't talking about? And I just pasted it in the chat for everyone as well.
The biggest one, well, the biggest problem within the disability community is the lack of an accessible subway station. You know, people have been talking about it, but discussion has fallen away. And that's extremely unfortunate. Buses are no substitute for an accessible transportation system. No one is talking about bus routes that are declining. And very often those bus routes are declining in areas where there are a lot of seniors buildings, where there are a lot of buildings where people with disabilities live in greater numbers. And the elimination of those routes is creating transportation deserts for the people who have the least resources and the people who are most likely to need public transportation. So those are a couple of things. The creation of public malls, and no one is thinking about what that means in the absence of accessible public transportation for people who then have been forced to use a car in order to park by their house because they don't have the ability, agility, stamina to walk from around the block or to walk from transportation to get to their home or to get to their doctor's office or their job. So what will happen to people who have placards in those environments? And what will we do all together to bring about a consciousness about creating a universally accessible landscape? What will we do so that people prioritize that and think that that benefits us all? Parents with strollers, travelers with suitcases, delivery people with bikes and carts. These are all important issues that are not being considered in a robust way in public media right now.
Yeah, if I can go next, I mean, I think I agree with a lot of what Susan said. And I think I actually have two answers to the question, one of which is kind of rooted in the nexus of what Susan was talking about, which is, I think one of the biggest problems that older adults aren't, that elected officials aren't fully cognizant of is the lack of engagement of older adults in planning and decision making. I think particularly in light of COVID-19, things have shifted online. We now do Zoom public meetings. We now do email updates. We do announcements to websites. Well, a lot of older adults are not wired. They do not have
Right.
high-speed internet in their homes. They do not have smartphones. They are getting their information from radio, newspaper, friends and neighbors, although that's all obviously diminished in time as well, and the phone. I mean, the landline phone, an actual landline phone, is many people's primary mode of communication still. And I know that's shocking to a lot of people, but it is. So, the reality is that we need those kind of low tech, frankly, a little more tedious ways of getting the news out to every member of our community and making sure that we have ways to include them in the process. We have a lot of very important decisions coming down the pike in terms of fiscal budgets and service delivery. Susan mentioned ridership and lines shifting. Those are decisions that impact older adults' lives in myriad ways, and older adults need to make sure their voices are heard in that. So that's one bucket of answer I have. The other bucket that is something that I think I remain stridently believing that this is the biggest untold story, is the effect of natural disasters and extreme weather events on older adults. I think there's an absolute lack. There's a blind spot when it comes to local officials and emergency management officials in terms of how older adults can respond and need to respond to those events. Think about something as simple as an evacuation order. Well, what is to be made of how is one to evacuate if they do not drive, if they do not have access to reliable transportation systems? What is to be made of people who are asked to move to shelters, but they can't because they are tied to either machinery that they need for health reasons, or they're tied to a pet who frankly is their lifeline and cannot be hosted at the shelter, and lots of other reasons. I just think there's a huge blind spot in terms of that mode of work. And I realize that's a little different than transportation, but it's related in terms of what older adults need to be, how they need to be contemplated better and served better by local officials.
Just to round things out, I mean, I totally concur with my co-speakers and co-panelists. Just two thoughts. I really like Susan's concept of transportation deserts. I think right now we live in an age, the fourth technological revolution, where there are a lot of accessibility solutions, and there are some areas I would call them kind of technological mountains, but then there are always these valleys as well. And that's a big problem. And we really need to audit these areas and figure out how to bridge these problems. And you can't have, I'm going to leave this city out of it. It's not New York City. There's some other city where I went to. I was advising for a blind nonprofit, and they spent so much money connecting part of the city with this infrastructurally based localization solution. They were so proud of it, and they had all these visually disabled pedestrians using it. And they realized they could only get to this one part of the city, and they couldn't get them anywhere else in the city. So it's like you had this one little area, and they were just stuck in this one area, and they wanted to go everywhere else. And then by the time they figured out how to do it, guess what? It wasn't compatible because the technology had leapfrogged over that technology, right? So the other big issue is forward compatibility. And we need to be really in tune with this. And so I think, the mountain and valley issue and then forward compatibility are kind of the two things that I would highlight. And it's really, really important to think about these things, because I've also been asked to advise on projects, and before they even get the projects off the ground, they're already having issues with the technology while they're installing the technology. And this is such a big problem at the city level. If we're going to spend $10 million on something, and before we even get it to see the light of day, it's already dead. Is that so much, so much money that can go to good use. And so I think planning is vital in all of this, and, thinking about, both bridging mountain and valley and also forward compatibility is really, really vital. So I'll leave it there because I'm sure we have other questions, but.
So much, everyone. Here's another question for all the panelists. Many transit agencies are unfortunately dragging their feet when it comes to implementing ADA requirements. We talked about subway stations a little bit, and that's definitely a part of it. While we continue to put pressure on the city to be in compliance, what are other things we can do to increase accessibility and at the same time as that pressure campaign?
Yes, I agree with you entirely. It is going to be a long process to bring the MTA and Department of Transportation, New York City Transit Authority, and